Do you know that infections can also affect the brain? One of the types of infection affecting the brain is known as encephalitis. Hello everyone, I am Dr. Anil Venkitachalam, a consultant neurologist at KJ Somaiya Hospital and Research Center, and I am going to speak to you all today on encephalitis. Encephalitis is a rare but serious condition wherein there is inflammation in the brain. Typically, it is caused because of an infection either by a bacteria or viruses. There are also other causes of encephalitis such as autoimmune disorders and medications. The symptoms of encephalitis can vary. They can be mild or severe depending upon the severity of the inflammation of the brain. Typically, patients present with headache, fever, seizures, altered behavior, speech problems, weakness or paralysis of one side of the body, or sometimes patients may present in an unresponsive state or a state of coma. Encephalitis can be caused due to various factors such as bacteria or viruses. It can also be caused due to autoimmune causes or certain other factors which cause an inflammation of the brain. Japanese encephalitis is typically caused by a specific virus, the Japanese encephalitis virus, which is transmitted through the mosquito bite. Japanese encephalitis is caused due to a specific type of virus, the Japanese encephalitis virus, which is generally transmitted through the mosquito bite. It is common in rural parts of Asia and Western Pacific region. In India, it is fairly common in the northern parts of India. Typically, a patient with Japanese encephalitis presents with headache, nausea, lethargy, rigidity, altered sensorium, excessive drowsiness, sleepiness, seizures, sometimes paralysis of one side of the body, speech problems, and if left untreated or unattended, these patients may progress to coma and even death. There are several factors that increase the risk of developing encephalitis, like exposure to bacterial or viral infections such as herpes simplex virus, West Nile virus, mosquito-borne diseases such as dengue and Japanese encephalitis can also cause encephalitis. Autoimmune disorders like lupus and rheumatoid arthritis can also cause an encephalitis. Apart from that, there is a spectrum of autoimmune encephalitis disorders and disorders associated with malignancy which can cause encephalitis. Also, patients who receive chemotherapy have a weakened immune system. Patients who have HIV, AIDS and hepatitis, they also have a weakened immune system which predisposes them to risk for encephalitis. Certain groups of people are at increased risk to develop encephalitis. Children below 5 years of age and elderly people who have a weakened immune system are at increased risk to develop encephalitis. People traveling to endemic areas where encephalitis is common are at increased risk to develop encephalitis. Also, people who have an underlying malignancy or cancer, people who are on chemotherapy, or people who have immunocompromised diseases like HIV or AIDS are at risk to develop encephalitis. Certain precautions need to be taken to prevent encephalitis. It is important to practice good hygiene, good stringent washing of the hands, good stringent cleanliness is very important to prevent encephalitis. Apart from that, whenever somebody is traveling to an area infested with mosquitoes, it is important to use adequate mosquito repellents and prevent mosquito bites. One can wear long clothes to prevent mosquito bites. It is also important to vaccinate oneself against encephalitis. Certain types of encephalitis have vaccines that are available which help prevent these diseases, especially if you are traveling to areas that are endemic with encephalitis. Early diagnosis and detection is the key to appropriate treatment of encephalitis. Most patients with encephalitis would need hospitalization. Once a patient is hospitalized, the patient would undergo certain investigations and tests to detect the type of encephalitis. They may need antiviral or antibacterial agents in order to treat the disease. Apart from that, it is important to provide supportive care. Supportive care is very important as it prevents the complication of the disease. Once appropriately treated, most patients make a good recovery from the encephalitis. Some of the vaccines available include vaccines for Japanese encephalitis, vaccines that prevent tick-borne encephalitis, and the FSME vaccines that are available to prevent encephalitis.